high-sensitivity C-reactive protein, and LDL cholesterol, are better targets for statin treatment in acute coronary syndrome. Controlling LDL cholesterol levels is the goal to prevent primary and secondary cardiovascular diseases. Hydroxymethylglutarol coenzyme A reductase inhibitors, also known as statins, are the most widely prescribed drugs for patients with acute coronary syndrome. Various guidelines recommend low-density lipoprotein cholesterol as the target for statin therapy. But there is a residual cardiovascular risk from inflammation by these targets. The purpose of the study was to examine high-sensitivity C-reactive protein and low-density lipoprotein cholesterol as the targets for the statin therapy in patients with acute coronary syndrome. Patients with either unstable angina or acute myocardial infarction were enrolled in the study. Patients who had myocardial infarction or revascularization or with a history of recent infection were excluded from the study. Patients with inflammatory conditions such as arthritis or lupus, or those who are administered with immunosuppressant agents, were not included. Hepatic or renal dysfunction patients, or those who have concurrent severe illness with expected survival of less than 5 years, were not enrolled for the study. The clinical endpoint of atorvastatin management was LDL-C less than 2.07 millimoles per liter in the LDL group, and that in the LDL-CRP group was LDL-C less than 2.07 millimoles per liter, and HS-CRP less than 3 millimoles per liter. The study was a prospective, single-center, double-blind, prospective randomized, clinical trial. The study included 400 eligible patients, who were randomly divided in 1:1 ratio to HS-CRP, combined with LDL-C, or to LDL-C alone, as the clinical endpoint of atorvastatin management after percutaneous coronary intervention. Patients undergoing percutaneous coronary intervention were treated with atorvastatin 40 mg per day for 1 month, and then with atorvastatin 20 mg per day as maintenance. The primary outcome of the study was occurrence of major adverse cardiovascular events. The secondary outcomes were hospitalization for unstable angina, secondary hepatic dysfunction, and cumulative 18-month survival. No statistically significant difference was found in the LDL-C serum levels between the LDL and LDL-CRP group at 6, 12, and 18 months. However, there was reduction in the serum LDL-C levels in both the groups. HS-CRP serum levels decreased remarkably over during the follow period in the LDL-CRP group than the LDL group. The incidence rates of major adverse cardiac events and revascularization were considerably low in the LDL-CRP group relative to the LDL group. High-sensitivity C-reactive protein and low-density lipoprotein cholesterol together are better targets for statin therapy compared to low-density lipoprotein alone. These targets can further reduce the incidence rate of major adverse cardiac events and residual cardiovascular risk.